Well, first of all, the European Bifurcation Club is a group of scientists, clinicians with multidisciplinary attitudes that are focused on the improvement of treatment of bifurcation. So over the recent years, there was a lot of step forwards into the comprehension of what is the treatment of bifurcation, so what we can do, what is really avoidable during our interventions. And all this knowledge is periodically, let's say every year, reviewed by this group. And the two stenting techniques are one of the main areas of interest. Why? Because they are complex. We know that they are very complex to be practiced, and the other point is the fact that the same technique may be practiced by different operators in different ways. And at the end, there is the feeling that the process of your procedure may influence the outcome of your patients. So on such a basis, into the European Bifurcation Club, there was a lot of discussion about the possibility to highlight if there are best practices with this techniques, and what emerged is the fact that it is very important to have clear cut in mind that they are complex. So if you embark in this kind of procedures, you should really know about which is the next step. And the other point is the fact that when you are performing two stenting techniques, regardless the type of stenting technique you selected, it is very important that you go on with your procedure until the end, which is when you perform a final kissing inflation, which is the one that allows you to have a best, distribution of the stent struts inside the bifurcation area. This is the main message. To achieve this, there are some small tricks that may allow you, once you decided one technique, to have successful completion of your procedure, and you may stay tuned with the publications that will come out and highlight very well which is the best practice with each technique. It doesn't matter if you are a fan of DK crash or culotte, you will find all the details for that. So the most important message for that is that if you look at the number of steps that are needed to complete successfully a double stenting technique, you realize that it is a long history. So the single stenting, which is the provisional approach, is something that it looks really appealing due to the fact that it is simple. So when you have a simple lesions, it makes sense to use a simple technique. When you have very complex lesions, first of all, think twice before embarking if you are not experienced operator. The other point is that you may rely on the provisional approach that is also very useful to have a successful double stenting implantation at the end. So single stenting technique might be also used to end up your procedure with double stenting in situation where the lesion is very complex, but we have also valuable double stenting technique that can be considered according to the individual operator's practice.